In this episode, we're going to look at nutrition and cancer. Specifically, we're going to look at the impact that cancer has on nutritional status by considering that within the context of the various common types of treatment there are for cancer, but also to look at the methods and strategies that we should consider and put in place for our client if they're undergoing treatment for cancer, or again, if they're recovering from cancer. So our overview is quite simply this. We're going to look at why good nutrition is important for cancer patients. We're going to look at how cancer and cancer treatment can cause malnutrition, why eating habits are important during and after cancer treatment, how cancer and cancer treatments can cause side effects that can affect nutrition, food trends in cancer care, and that's quite a big one for us to unpack, really, because there is a lot of fads and mythology around the notion of nutrition and cancer currently, with everything from promises of cures all the way through to these kind of crazy behaviors that are being broadcast all over multiple means with regards to, what we can do to prevent ourselves from ever getting it. Now, prevention is key, and we can have a huge success with prevention, but we can never eliminate the possibility entirely, okay? Cancer is such a condition that whilst we can do the very best we can to minimize the risk, we can never completely eradicate it. But we're also going to spend a little bit of time looking at the low residue diet, because this relates to a specific type or treatment of cancer. And this is something that is very commonly come across whenever you're supporting a client through their cancer pathway, given the nature of the treatment and the surgery and the specific cancer that they could potentially encounter. So what are the benefits of good nutrition? Well, it should come as no surprise that here, just like anywhere else, the benefits of good nutrition stack up. They're exactly the same as they are without the context of cancer. So it supports the function of the immune system. I always think it's important to stress that as in the normal function of the immune system. There's been a lot of talk recently which has very provocative language that talks about boosting and optimizing and enhancing. And this is very attractive language. But in reality, we need to get back on track with the notion that a normal immune function is incredible in itself. It's 6 million years in its evolution. It's remarkable with regards to the context of how it helps us to overcome and deal with illness, everything from acute to chronic. It's a fundamental component of our recovery from exercise training stimulus. So whenever we're having conversations with our clients and whenever we're considering immune function, remember that normal immune function is the pinnacle. That's what we're trying to sustain. That's what we're trying to re-establish if it's lost. Good nutrition protects against further non-communicable diseases and those comorbidities. And really the past 2 years has increased everybody's understanding of what comorbidities are. These are those multiple health factors that when combined contributes to more difficult outcomes, more negative outcomes. So for instance, somebody who's overweight to obese to developing type 2 diabetes, well, these in themselves, certainly obesity and type 2 diabetes, one could quite confidently argue that they are themselves 2 comorbidities. Then if we were to develop a cancer off the back of that, which is not unusual, then we're dealing with 3. So we have multiple comorbidities. And this has a real impact on pathology. It makes it far more complicated. There's far more work to be done and actually heightens the person's risk of the worst possible outcomes and certainly the most severe symptoms. So comorbidities should be our consideration from the start. And the simplest one, which is very common to track through any kind of nutritional behavior, is to look at weight management, managing our weight, not allowing our clients to go down this road of assumption that as we get older, we generally put a bit of weight on. That's nonsense. If anything, as we get older, we should be far more mindful of this and make sure we're more considerate of how we manage our weight, because this weight gain, overweight to obesity, really is the high road towards developing more complex conditions. So if we can keep that in check through good nutrition, then we really are achieving a lot, which ties us straight into maintaining a healthy body weight, maintaining energy levels. this is one of the key contenders as to why people make poor dietary choices, getting trapped in the dopamine cycle, getting trapped in the quick fix sugar hit with confectionery and sweets and these types of foods. People feel a bit of a slump, so they reach for that food that's going to give them a bit of a high, that roller coaster ride of sugar spikes and dopamine cycles. When we have a diet that's far more firmly rooted in nutrients, in sustainable energy release, or a favor towards those complex carbohydrates, those fibrous carbohydrates, making sure we have sufficient dietary hydration, as well as the hydration strategy that we have around that with regards to drinking our water, then we have more sustainable energy. That's useful to us in what we do for our daily lives. It's really useful to us in regards to our preparation and dealing with physical activity and exercise. But when we have these more stably maintained energy levels, then we don't have the cravings. It's really simple. We can crush those cravings because we don't want that quick fix, because it's unnecessary, because we're not lending ourselves towards that. So the maintenance of energy levels, again, is a critical aspect. A sense of wellness. This does not get talked enough about. I love the Laird Hamilton quote, which is that he's addicted to feeling good. Often people don't realize really how unwell they feel or how under par they feel until they feel well, and until they feel well for a sustainable amount of time, so for a prolonged period of time. And this comes off the back of good nutrition. Definitely what contributes towards that is our increased physical activity, our exercise, for sure. But nutrition is at the heart of this sense of wellness. Cliche, number one, you are what you eat. As I like to back up consistently, you are what you absorb. So it's very much the essence of what we are. And when we eat well, when there's greater quality of what we put in the tank, then the direct outcome of that is an increased sense of wellness. And then it supports recovery and restoration of bodily systems. This is really important in the context of exercise for your clients, and it's really important. It's paramount in the context of dealing with cancer and cancer treatment, because much of that cycle is about recovery. So when we look at how, and there's a breadth of research in this area, good nutrition enhances treatment outcomes for cancer. Huge part of that is that it fundamentally supports recovery between treatment bouts. So we're getting, we're bringing the client back to a better state so that they can cope with the next wave better, because they've regained a level of their robustness. They're in a better state. I often think of this architecturally from a muscle and bone point of view, but obviously it reaches with regards to more systemic factors and nervous, and then certainly cellular factors. But if we just consider that alone, the fact that it's going to help the body to recover whilst it's undergoing treatment and in between those bouts of treatment, it earned its place within as a priority for our consideration, simply based on that. So the importance of healthy eating habits. Well, if we consider nutrition now slightly differently, when you're working with your client, it could be a part of a lifestyle management when you're looking at nutritional changes. More often than not, I think it's fair to say for most PTs and for most coaches, it comes down into that weight management factor, whether that's with regards to losing weight, maintaining weight, gaining weight, muscle mass. When we look at it in the context of supporting somebody who's undergoing treatment, particularly for cancer, it's essential that we look at it as a nutrition therapy. Now, that's not to say that we're going to become nutrition therapists or any kind of grand title, but what you've got to look at is there is a dose response rate to what we do. By eliminating those foods that are actually serving only to undermine what we're attempting to achieve, and what the oncologists are attempting to achieve, and the surgeons and the people who are working medically around your client, what we have to look at is thinking of the direct consequence and impact those food choices have. So think of it as therapy, even if you never use that language with your client, think of it on those terms. Nutrition therapy is used to help cancer patients maintain or reach a healthy body weight, strength, which is fundamental, and to keep body tissue healthy. So remember, most of the treatments, and we're going to delve into those treatments in a minute, take a huge toll on the body. They really do. And we're constantly trying to counteract that. We're trying to lose as little as possible and regain as much as we possibly can. And that sounds familiar. It's a bit like our approach to typical exercise stimulus. We want to limit the catabolic effect and magnify the anabolic effect. That's the art of what we do. Here, it's just more vital. It's a more vital component. It can make the difference, certainly in quality of life, and more often than not, in the measure of outcome with regards to successful treatment, medical and surgical. Another key part is that we want to decrease side effects, both during and after treatment. I'd imagine that we live in a world now where most people have some level of understanding of the side effects that come with being treated for cancer. The fatigue, common things like loss of hair, it's very simple, it's very common and easy for people to become a little bit anemic. There are multiple factors. Again, we're in that tug of war game where we're trying to counteract, we're trying to minimize the potential damage and maximize the recovery. Consider that on every front when you're dealing with a client who's presenting with a type of cancer. Cancer treatments that affect nutrition. So I want you to imagine for a moment you have your client, and maybe this is someone that you've worked with prior to their diagnosis, or it's someone who's arrived with you because of their diagnosis. And there's the notion that they have this is very common, they have this type of cancer, they have this type of cell proliferation, this type of tumor, however it's manifest and presenting itself. And this is like causing harm, wreaking havoc. This is the cancer doing what the cancer does. And then the surgeons, the oncologists, the people, they're going to go in with their medical treatment and they're going to treat that. And that's what's going to happen. It's not actually that simple. The treatment itself, the common treatments, take such a toll that this brings about a change in how a person behaves. That directly influences and affects how they eat, how they can eat. So it's important to recognize that these are not isolated. None of this works in a silo. This is having a very much a joined up and grouped in a combined effect. And really, it's only by standing back and looking at that and taking that full stock that we can be really effective in doing something about it. So the treatments that affect nutrition: chemotherapy, hormone therapy, radiation therapy, surgery, immunotherapy, stem cell transplant. You could step back and say, what are the most common treatments for cancer? Chemotherapy, hormone therapy, radiation therapy, surgery, immunotherapy, stem cell transplant. So our big go-to list are also the ones that bring about changes to nutrition status. If the head, neck, esophagus, stomach, intestines, pancreas, or liver are affected by the cancer treatment, it becomes harder to take on enough nutrients to remain healthy. And in most instances, these areas will be affected. I think the best assumption, one should never assume, but the best assumption, if you must have one, is to assume that there is going to be a negative impact on these areas, and therefore to plan and brace for it, and to start to think of your strategies around what you're going to do to maintain good nutrition behavior with your client, how you're going to get them, what's your strategy going to be with regards to the nutrition plan, so that they've got a strategy with regards to their behavior and what they can do. If ever there was an area that's going to be bespoke and related purely to the individual, I promise you it is this. There are so many factors that come into play here. So recognize, assume from the start, it's going to be tough. So malnutrition. And again, this is often an area that people don't really consider automatically in the context of cancer and cancer treatment, but hopefully you will treat it as something first and foremost now that we've covered this. Cancer and cancer treatments can affect taste, smell, appetite, and the ability to eat enough food or absorb the nutrients from food. My little cliche, you are what you eat, more importantly, you are what you absorb, both get compromised. This can cause malnutrition, which is a condition caused by a lack of key nutrients. Energy is a factor, by the way. Calorific intake is obviously a factor, particularly when there's any kind of weight management issue, retaining muscle mass, retaining overall body weight, or managing things down. But what really needs to be the focus of your attention is quality. It needs to be those key nutrients and sufficient nutrients going through the system on a daily basis. Malnutrition can cause the patient to be weak, tired, and unable to fight infection to finish cancer treatment. And sadly, this is quite common. So the toll that's taken by the treatment itself reduces the individual down to such an extent that they don't actually survive the treatment, or they develop a secondary illness, get an infection, and then that becomes the issue, and focusing on that and trying to treat that diverts away from continuing with the cancer treatment, and then the individual, your client, becomes the victim of what's happened in the wake of it. So nutritional status is so important. By keeping them well, by going back to those top reasons given by the World Health Organization as the benefits of good nutrition, it could never be more vital than in this instance. Malnutrition is worsened if the cancer grows or spreads, and eating the right amount of protein and calories is important for healing, fighting infection, and having sufficient energy available. Again, this is really big factor stuff that is the same elsewhere. If your client doesn't have cancer and they're purely focused on gains within the gym, what is it we're looking for? We always work towards the notion of preserving and optimizing health. Never sacrifice that in the pursuit of a gain. You shouldn't anyway. Next, we want to make sure that we are able to remold those muscle tissues, those neurological areas that we've broken down through the exercise stimulus. And we want to have sufficient energy to participate in the training, the nature of the training, the duration of the training, sufficient energy to recover effectively, and sufficient energy to be able to embrace life, physically engage, and do all the stuff that we should be doing. So it's all the same principles. It's exactly the same principles. And this is what we typically find as we start to unpack these things and we go through multiple areas. It's just that here it centers upon what it is that the cancer is doing to them and what it is they need to do to counteract the treatment of the cancer and enable that treatment to be more successful. So let's spend a little bit of time now delving into each of the areas of type of treatment. I'm going to have to do, unfortunately, my least favorite type of presentation or workshop, which is where we read from slides. And I'm doing that, one, so that we can consider these points meaningfully. And secondly, for those learners who, rather than watch this video, are instead going to choose to purely listen. So chemotherapy and hormone therapy. Chemotherapy affects cells all through the body. Chemotherapy uses drugs to stop the growth of cancer cells, either by killing the cells or by preventing them from dividing. Remember, cancer is essentially the proliferation of those cells. And chemotherapy is chemical therapy. There are various different types, cocktails of chemotherapy, and they are an onslaught. They are going in there either to kill those cells or to stop them doing what it is they intend to do. It's a very demanding, it's quite a brutal type of treatment in reality. However, healthy cells that normally grow and divide quickly can also be killed. And there are certain types of cells that do this. These include cells in the mouth and the digestive tract. So we can see already that the nature of the treatment is going to indirectly affect a certain type of cell that performs a certain way. And this has a huge consequence with regards to digestive processes. So we have this chemotherapy that is going in. You know, I often like to think of these things in battle terms. And this is our infantry going in, and they are literally taking everything out. They know their target. It's going to be those fast proliferating cells, those ones with high transfer turnover. It's going to kill everything. And sadly, in the process of that, there's going to be a bit of friendly fire. Some of the ones that function the same way, well, they're going to get taken out too. And this is why, because of the impact on digestion, we need to think of those foods that have got a greater nutritional content, We've got to think of how the body digests food, what we can get through more effectively, and what we need to have a sufficient amount of to give it more chance to do what it is it needs to do. Hormone therapy adds, blocks, or removes hormones. It may be used to slow or stop the growth of certain cancers. And some types of hormone therapy are known to cause weight gain. Because remember, hormones are a part of the body's communication system. So when we block or stop some of them, then some of that communication becomes interrupted. And therefore, things like appetite, things like how we respond to a certain type of food, the timing of it, these can be negatively affected, and therefore we can see these changes in body mass. I mean, there is a direct reference with regards to weight gain, but also this can be a part of the problem that brings about fundamental weight loss because of the nature of the chemotherapy and the hormone therapy. So this is literally just the impact of the therapy itself, what we're actually working with, because we need this therapy to be successful, but kind of countering with a better nutritional strategy. Side effects from chemotherapy can cause problems with eating and digestion. So we know that from the start. Remember a few moments ago I said, assume it's going to be complicated, assume it's going to be difficult. Go forward with that. So we need to start to consider high nutrient content foods that have quite a easy palatability. So you don't want things that are too distinctly taste, because that can put people off when they're not feeling great and they're feeling broken. Your client's really struggling with the nature of the treatment itself. Overwhelming textures and tastes can be difficult. And often people will then start to head down the road of using, as a part of their strategy, things like smoothies. One, because there's less of a digestive load. Two, you can get a lot of nutrients in, so it can become this ready-made fix, but it's not the be-all, end-all. It's not an answer. We do need to look at how we can get whole foods and real foods through the system. We need to look at portion sizes. We need to look at managing those kind of taste expectations. And this comes down to your work with the client, understanding what it is they like and loathe, and how you can work around that, and where you've got to draw those lines where you say, well, we need to persist with this purely because of the nutrient benefit of getting this into the diet. This is really common with the leafy greens, things like broccoli and kale and spinach, that some people can have quite a strong reaction to, really not like the taste, the earthiness of it. But these are those kind of areas that become non-negotiables because of what they do. Maybe that's where you go for your green machine kind of smoothie to get these things in. But that can't be a one-trick pony. You've got to look at how food and food behavior is developed over this time with your client, so that it's a far more sustainable approach. When more than one chemotherapy drug is given, each drug may cause different side effects, or when drugs cause the same side effect, the side effect may be more severe. So we can have this real collision factor, multiple side effects, or we can have this real amplification factor. So it becomes far more severe. The way to account for this is to keep in good communication with the client, is to be able to engage with them and capture this information with regards to how they're feeling. The more immersed in the whole process you are, and not just kind of helicoptering in to just do the physical activity bit, just do the exercise bit, in this instance, just do the nutrition bit. The more you are in it, as in understanding what treatment pathway they're on, is a chemotherapy, is a hormone therapy, what treatment pathway are they on, the timing of that, the time and expectations of that, how long they've been on it. It's great if you can work with the client from the start as this commences. But experience tells me more often than not, you'll probably pick up a client part way through or at a later stage. But if you can be from the start, all the better, because you can work through this stuff as it comes about and respond more to those changes. But you do need to be immersed in the process. You need to understand the nature of their treatment, how long it's been going on for, how long it's likely to last for, and also work with them on that trial and error, knowing that you're keeping a key eye on those really important foods. There is another episode in this program which is about epigenetics. That's a good way to start and commence and start to consider the types of foods that need to feature here, and then building your plan around how they're going to feed you. So our common side effects, are loss of appetite, nausea, vomiting, dry mouth, sores in the mouth or throat, changes to the way food tastes, trouble with swallowing, feeling full after eating only a small amount of food. That's really, really common. So with that, you need to start looking at your food frequency. You need to start looking at how you can create a sustainable snack method for your client so that they're getting good hits of nutrition in smaller amounts spread out across the day. Because we still don't want to bring about any kind of negative weight loss. We don't want to lose weight just because we can't get the nutrition in. So we need to look at food frequency, eating more often, but smaller amounts. Constipation can be an issue, diarrhea. And what you have to recognize is that when someone's dealing with loss of appetite, food and eating becomes functional, and that can become tedious and hard work. When there's nausea, vomiting, this can be a real barrier to someone wanting to actually replenish and put more food back in. And likewise, and it might seem really low level, but constipation and diarrhea, when there are issues at that end, typically a person, if it's diarrhea, they're going to have some impact on their hydration status, likely to become a little bit dehydrated, washed out, and the last thing they want to do is eat. So these are all things that are likely to change as a part of their treatment pathway, but you've got to be responsive to. And one word I would put in at this point is worry less about what you achieve on a daily basis, even though each and every day matters, and consider more what you're achieving within 72 hours. You know, this is a way to give yourself a longer rhythm to plan for nutritionally, and be making sure that within these kind of 3-day timescales, there is sufficient amount of nutrition overall, sufficient amount of energy overall, that we are at least, the worst instance, maintaining what level of health status we currently have, but always with an eye towards improvement, always trying to improve things and put that client in a better position with regards to their recovery and their restoration. Patients receiving hormone therapy may need changes in their diet to prevent weight gain. So do bear that in mind. That hormone pathway is a huge part of the body's communication pathway. And if that triggering response is there with regards to them gaining weight, then we've got to be responsive to that. And we can't just brutally go in with excessive calorie restriction. We've got to be more clever than that, because we've got to keep the nutritional profile. We want to make sure that we're getting essential vitamins and minerals in and sufficient energy to cope. Without energy, the client cannot survive effectively the treatment that they're undergoing. So radiation therapy, this kills cells in the treatment area. So it's very common that a person will go through a bout of chemotherapy to radiotherapy. So it's kind of coming at the issue from two slightly different angles, but have a great commonality and similarity. Radiation therapy kills cancer cells and healthy cells in the treatment area. So we looked at chemotherapy and how that can really damage or kill cells that behave a similar way. Radiation therapy will go in and kill whatever's in that area. That's what it does. It's a real. So this is, you know, we've had our infantry go in. Now we're just going to bomb everything. So this is our jet planes going over, and we're just landing down missiles, taking everything out. So how severe the side effects are depends on the part of the body that is being treated, the total dose of radiation and how it's given, and radiation therapy may affect nutrition for these reasons. There's real commonality that runs through these. Radiation therapy to any part of the digestive system has side effects that cause nutritional problems. Most of the side effects begin 2 or 3 weeks after radiation therapy begins and go away a few weeks after it's finished. So you almost get this honeymoon period, 2-3 weeks in, where you think actually things are okay. The client feels like they're keeping up with their nutritional plan, don't feel too bad, and then the impact of it starts to take hold, and there can be this washout and this far more difficult period that kicks in after that. So again, plan for it. Know it's on the horizon. If your client is going to have radiation therapy, this is why you need to be immersed in what type of treatment the individual is going through, so that you understand what's coming up on the horizon. It's going to get complicated. Let's start to plan for that now, because it's quite, it's to our benefit to get the client to practice for the worst part prior to the worst part hitting. And what I mean by that is it could be that currently, in the wake of their chemotherapy, you've got them on 5 meals a day and they're coping well with food orientation and type, and certainly from a taste point of view, everything's ticking away. But you know that this radiation therapy is coming up, and that within a week or two, there's likely to be changes to this. So maybe take it up to 6 meals a day, reduce the portion size, start to consider, other things that you could use as a strategy. This is where you get into that whole kind of smoothie shake area with regards to getting key nutrients in. Can you start to get clever about some of your supplementation here? So rather than we don't want people rattling, but rather than relying purely on whole food diet approach, is this a good opportunity to look at some really smart, intelligent supplementation that can complement what it is that you're doing and take some of the load off those quality factors, so that you can look at calorific factors, either increase or reduction, in a far more black and white contrasting way. It should be noted, though, that after radiation therapy, some side effects can continue for months or years. So this is a classic case that someone is treated, the treatment is classed as successful, they get the all clear, but what they're left with is the legacy of what that treatment's taken. And this is whereby you could be working with your clients on their nutrition program for 6, 12, 18, 24 months after they've been classed as needing no more treatment and essentially cancer-free. So do bear that in mind. A lot of what you're laying down the tracks for whilst the person's undergoing their treatment could be what you build on in the wake of it. For radiotherapy, to the brain or head and neck, we see a loss of appetite, we see nausea, vomiting, dry mouth or thick saliva. Medication may be given to treat a dry mouth, sore mouth and gums, changes in the way food tastes, trouble swallowing, pain when swallowing, and being unable to fully open the mouth. So there are some mechanistic factors that start to come into play at this stage. And again, we didn't mention this earlier, but we'll spend a second on it now. When they've got sores in the mouth or a dry mouth, this, over time can become really demoralizing. There's a huge psychological component to this. When a person just simply by putting food in their mouth is in discomfort, this is a huge barrier to making gains with regards to a nutritional strategy. So you've got to be responsive to this. You have to listen to what it is that your client is reporting back. And again, then start to consider, well, how can you work your way around that? Now, we can't have every substitute being a smoothie, but it could be that you move more towards a soft food diet. This could be changes in how you prepare food. So preferring to steam or boil foods so that we get a different texture to consume. Those kind of clever thinking ideas are what make a big difference here when we're responding to those things. Because obviously, if the mouth is dry, if it's sore, if there's thick saliva, then dry or food that has a firmer texture that's harder to chew is going to be more problematic. So start to consider these as integral to the strategy for the client, working around these factors that they're having to deal with that themselves are immediate barriers to them achieving good nutrition. For radiation therapy, to the chest, loss of appetite, nausea, vomiting, trouble swallowing, pain when swallowing, choking or breathing problems caused by changes in the upper esophagus. That is really something to watch out for as well. This notion of choking and then sudden breathing issues when engaging with a meal, a snack, even drinking. These can bring about acute incidents. So if these start to be reported, this is something that your client is going to have to report back to their team and may need more support on. But again, it could be that you want to go through a period, therefore, of changing the nature of the types of food or how these foods are prepared, again, going towards that soft-based diet in order to get around this. because what we don't want to do is get to the point where we're just not getting nutrition in. That can never be the outcome. We need to work towards food behaviors that are realistic, meaningful, and sustainable for the longer term, because we don't know how long any of these periods are going to be. So think less of short, sharp shock, and think more of a consequence, a series of interventions that are eventually going to guide that person towards a lifelong sustainable eating habit. For radiation therapy to the abdomen, pelvis, or rectum, we see a loss of appetite, nausea, vomiting, trouble swallowing, pain when swallowing, choking or breathing problems caused by changes in the upper esophagus. So we're seeing a lot of commonality here, but it's important to recognize and group things so that we know what we can expect. Surgery. I think surgery is one of the things that is most commonly overlooked when people consider somebody's treatment for cancer. Everybody's really familiar with the notion of chemotherapy, radiotherapy, but surgery is rarely common, happens in most instances. And surgery has a double factor. One, the direct change it makes to the site that the cancer was present. And secondly, the typical soft tissue associations that we have with surgery. 9 to 12 months for a full recovery, regardless. And I know there are people who like to talk about accelerating this, speeding it up, reducing it. There's no clear evidence that supports that. And we have to take an evidence-based approach. We know fully, consistently, that soft tissue trauma and the recovery from that takes a good 9 to 12 months, standard. And we want to put everything in place that's going to recover that soft tissue. So this impacts directly on our nutritional considerations, making sure there are sufficient amounts of protein available, making sure there are sufficient amounts of carbohydrates so that the person's got the energy to recover, something that's often overlooked. And then again, those fats, those polyunsaturated fatty acids, which remember are described as essential fats. Very few aspects of our diet, certainly when it comes to the macros, that are described as essential. The PUFAs are, particularly the omega-3, in the context of managing inflammation and bringing about a greater cellular status, cellular ratio between that 6-3 and lowering overall systemic inflammation and stress. So the physical impact of surgery increases the body's need for nutrients and energy. The tissue's been broken down, literally. It needs support to remold. The body needs extra energy and nutrients to heal wounds, fight infection, and recover from the physical trauma associated with their surgery. If the patient, your client, is malnourished before surgery, it may cause problems during recovery, such as poor healing or infection. For these patients, nutrition care may begin before surgery. In fact, I would say if you know your client has surgery coming up, treat that like it's an event. Treat that as though they're going to take part in the toughest competition of their life and do some pre-event strategy. So make sure that we're trying to optimize things. You want to go in there peaking, nice, strong, robust, and stable. So think about those kind of nutritional needs. It'll probably be reflected somewhat in your exercise and physical activity prescription as well. But make sure that they're going in there optimized from a nutritional point of view prior to taking this surgery on. Most cancer patients are treated with surgery. Surgeries to the head, neck, esophagus, stomach, or intestines can affect the nutrition status of the patient. And these are all common areas for surgery. Surgery that removes all or part of certain organs can affect a patient's ability to eat and digest food. The following are nutrition problems caused by surgery: loss of appetite, trouble chewing, trouble swallowing, feeling full after eating a small amount of food. That last one, as again, we can see there's commonality here to other treatment modalities, but this last one, feeling full after eating a small amount of food, do not underestimate that, because this can become the single biggest barrier that your client will experience. They'll have a small amount of food and that's it. It's like they've eaten at a banquet, had a huge feast, and can't possibly take another mouthful on. That period of time it takes to digest, that period of time in order for us to get that deload within the stomach, in order for them to even be inclined to want to eat something else, is a huge part of our overall success throughout the day and throughout those 72 hours with regards to how much more nutrition we can get in. So we have to work with this. And the rule of thumb I would encourage you to go for is within the first few meals, figure out the point at which before they become full. 3 or 4 mouthfuls earlier, call that the meal, so that they never max out. They never feel absolutely stuffed from any one small meal. So avoid reaching that level of satiation. Takes a little bit of time, takes a little bit of practice, but it's better to be able to have more increased opportunity to get through by never actually reaching fullness than it is to eat till the full and then say, right, let's see how long it takes before we can get another meal in. It's about having a forward-thinking, proactive strategy, saying, well, this amount is being tolerated, so we'll stay with that. We're a few mouthfuls short of reaching full, and then we plan to have another meal 2.5, 3 hours later, whatever the timing is, with regards to your strategy for your client. So consider it that way. Like anything else, it's trial and error, it takes working with the individual, but experience and evidence would suggest that that's a far more effective way to work with that problem. Immunotherapy. Side effects of immunotherapy are different for each patient and the type of immunotherapy drug given. However, the following nutrition problems are common. Tiredness, so we get that level of fatigue. Fever, increased body temp. Nausea, vomiting, and diarrhea. Some of these are quite pronounced side effects, particularly fatigue, fever, and nausea. These can have a long-lasting effect. Again, when somebody's vomited, they're unlikely to want to consume any more food within an hour or 2 hours, and diarrhea brings those problems of one, and knock on to the sense of appetite and willingness to eat, and then those hydration factors. So we do need to have a strong hydration strategy across the board, aiming towards that 8 glasses per day. Also looking at the dietary hydration factors, what we get through our fruit and vegetables. But when there's diarrhea, we want to at least add on top of that another 10 to 15% to adjust for what's potentially lost. Likewise with vomiting, we're losing fluid from the body. Fever can be a really, really difficult one, because with the fever, with increased temperature, we get increased metabolic output. So we probably need to look at how we can upregulate the calorific input in that instance, so that the person isn't running into an unwanted deficit. So do bear that in mind. But again, make modest adjustments just by increasing by 5–10% max and seeing whether or not you can stabilize. And you're also going to be working around all those other difficulties that we've already discussed with regards to their appetite, willingness, and desire to eat. It's complex. It really is. There is no textbook, you must do it this way. Or maybe there is. The textbook way to do it is be immersed in the client journey. Work with them. Communication is key, but keep focused on what it is that you're trying to achieve. And as I've said, from a nutritional point of view, consider your success far more over 72 hours. From a hydration point of view, though, that has to be a daily strategy. We cannot run the risk on dehydration. But because of that, don't fall into the trap of hyperhydration, because that's going to bring about problems too. Just keep a gradual check. If we're hitting that 8 glasses of water every day, most days, on top of that, our dietary hydration, we're probably going to be in good shape. Stem cell transplant. Patients who receive a stem cell transplant have special nutrition needs. Chemotherapy, radiation therapy, and other medicines used before or during a stem cell transplant may cause side effects that keep a patient from eating and digesting foods as usual. So again, we've gone from the complex to the massively diverse and complex now. Common side effects include the following: mouth and throat sores and diarrhea. Plus, if we go back through our common side effects of those other types of treatment, we've got all those as confounding factors. Stem cell transplant is a really promising area of cancer treatment and a really effective area of cancer treatment. But from a nutritional point of view, it comes along with a whole host of complications. So be optimistic, but at the same time, be realistic with regards to your nutritional planning. Get your guard up, think of your client, think of what changes are likely to come their way, and be proactive. Start to plan. Straight away, the mouth and throat sores, we've already discussed this in prior context. If there's going to be difficult around that because of the textures that are within the mouth, then we start to consider what are our soft meal options and how can we make that engaging. Remember, the client is going through a tough time. And the last thing they need is a really dull, non-inspiring nutrition plan that we're going to put all this emphasis on that's really, really important, but that they just feel zero willingness to participate with because it brings no sense of satisfaction or joy to their day whatsoever. So this is all about discovering their likes and dislikes and what you can use to incentivize them and encourage them to eat well and eat better and eat consistently and eat frequently. There is no textbook answer, but all of these key concepts and principles should be giving you a criteria that you can work through with your client if and when they're undergoing this type of treatment or experience. Patients who receive a stem cell transplant have a high risk of infection. Chemotherapy or radiation therapy given before the transplant decrease the number of white blood cells which fight infection. After a stem cell transplant, patients are at risk of acute or chronic graft versus host disease, GVHD. GVHD may affect the gastrointestinal tract or liver and change the patient's ability to eat or absorb nutrients from food. This is why you need to be immersed. If this is reported with regards to observations from a clinical point of view of what your client is dealing with, if there's any talk of GVHD, then you need to recognize that there's been this real shift with regards to what they can eat and what they can absorb, how they can absorb nutrients from food. So you need to get your thinking cap on. You need to start to think forward. You need to start to think of what other types of food are going to give me the same type of nutrient availability that we can try, that we can work around and see what impact that has. A lot of it is trial and error, but where it fails is more often than not where most people just give up trying. Genuinely, that's where this fails, is where there's a lack, there's almost people reach a certain roadblock and go, well, we've tried this and that's that. Promise you now, through experience, you just got to keep finding a new way. Try and just alter your approach, but stick to the principles. So if a person, for instance, is having difficulty with one of the dark leafy green group or one of the berry groups, then just try a different type. See if you can prepare it a different way, from oven baked to steamed to boiled to mashed, whatever it is. Just keep trying a different route, explore different avenues, and remember those key nutrients on a daily basis. We want to make sure that a person is getting sufficient amounts of vitamin C, vitamin D, B6, B12, K. We want to make sure that these are key components. We want to make sure they're getting sufficient amounts of protein. I would advocate in most instances, because of the type of muscle repair, tissue repair that's going on, the average person needs to be around about 1.4 to 1.6 grams per kilogram of their own mass of protein. So start to think, how is that going to make it into the diet? How am I going to plan this for my client? Is this where we rely on a really good supplement? Likewise with those omega-3s, those PUFAs, can we get that in purely through the diet? Or what really good, effective supplementation is available to me that's going to work with this instance, with this client? Is there a water-soluble type of omega-3 supplement, because that's going to help with digestive factors? Is there a vegan option? You know, how are we going to work around getting these things into the diet? It really is about being able to stand back and look at the map, see all those different routes, recognize the ones that have met dead ends, and then start to forge a new one. No two clients will ever be the same. So how to deal with symptoms of nausea, vomiting, dry mouth, mouth sores, taste changes, sore throat and trouble swallowing, lactose intolerance, weight gain. Well, we have a supporting document, all of which is informed by the National Institute of Health Research, taken directly from their content, and that supports this episode. So please refer to that document in support of this episode with regards to how to deal with those symptoms. To do a episode like this about that will probably take 7 or 8 episodes of an hour long each one. So we've put together that document that's easy for you to access and is going to give you key bits of information with regards to how to work around these areas. So probably most likely one of the most valuable aspects of this episode. Let's have a look at some popular trends in cancer and where the research is at. Okay, so vegetarian or vegan diet. It is not known if following a vegetarian or vegan diet can help side effects from cancer treatment or the patient's prognosis. So I know that there is a lot of talk out there, and I find this interesting. I always read and follow it through and then counterbalance that with the weight of the research evidence in the area. And whilst it might look attractive, there is certainly nothing that really suggests that it's any more powerful than what might be classed as a non-vegetarian, non-vegan, or a carnivore diet. However, if the patient already follows a vegetarian or vegan diet, there's no evidence that shows that they should switch. So just be, whilst there's no evidence to suggest any more effective, likewise, we shouldn't encourage that person to stop being vegetarian or vegan, because we know that we can successfully hit the nutritional values we need or our client needs by pursuing that. It's just another thing we need to consider in all those roadmaps that we're going to plan as to how we're going to work through this problem and derive effective solutions. The macrobiotic diet. A macrobiotic diet is a high carbohydrate, low fat, plant-based diet. No studies to date have shown that this diet can help cancer patients. No quantifiably verifiable peer-reviewed publications have reached any kind of consensus that a macrobiotic diet has any great efficacy with regard to supporting cancer outcomes. That's a fact. Again, personally, as a registered nutritionist and as an exercise nutrition scientist, as a researcher, I find the whole area of the microbiota, the microbiome, really intriguing and fascinating. And I do believe that there's some pioneering research going on in that area. But the macrobiotic diet, which is this high carbohydrate, low fat, plant-based diet, to date is not showing any compelling evidence to be any more effective. Let's pause for a moment on sugar. There is a lot of talk around sugar and cancer. Arguably, this comes down to some really early research from the 20th century that showed that the cancer cells themselves are fueled by glucose glycogen availability. And this provides the core nucleus of how those cells proliferate. I think if we look at this in modern terms and modern understanding and we stick to the evidence base, it's important to recognize that sugar is what's called empty calories. I'm not a big fan of that phrase, but what we mean is that sugar has no nutritional benefit. It purely adds energy to the system. Fast acting energy, so not slow release, so not typically the type that we favor or pursue. Secondly, we know that sugar brings about systemic inflammation. So it increases our inflammatory markers. It brings about sugar spikes. This is thought to be and considered within the context of insulin response and insulin sensitivity and the whole complex nature of what leads us towards the development of metabolic conditions and type 2 diabetes. What we know is that sugar does wreak havoc with the body's physiological and hormonal responses. And there is a lot of research that's going on currently now that looks at the impact of a low sugar diet. And in fact, wherever possible, taking all refined and artificial sugars out of a diet. And the context of that with regards to risk of developing certain lifestyle cancers and certainly how it impacts on supporting successful treatment. That evidence looks really, really convincing, really, really promising, and that evidence base is growing. There isn't as yet a meta-analysis or a consensus around this, but the weight of that evidence is developing at such a rate that I'm confident that we will reach one within the next 2 to 3, certainly 5 years. The only thing that sugar does is add sweetness to the diet and calories. We know it aggravates the system. We know that as it's fast acting with regards to the glucose and therefore glycogen point of view, that any kind of fast proliferating cell is going to be fueled by it. So I understand the thinking on those terms. Whether or not the mechanism is that neatly lined up, that's still up for debate. But we do see consistently across the board where we lower sugar, where we eradicate sugar to all intents and purposes, and more importantly, we replace that with far more nutrient-rich energy provision, looking at those fibrous carbohydrates, those complex carbohydrates, going for those, far more wholemeal, whole food originated sources of energy. We see far more better outcomes consistently across the board. So I would encourage you with your client to look to how you can effectively and quite markedly reduce their sugar intake. The only exception to this, and it's so rare I've never had to use it personally in all my practice, is whereby if there's a real struggle to get a sufficient amount of energy in within a day or 72-hour period, then it will add that. To date, I've never had to use that as a strategy. Never. And I've only ever seen positive impact with regards to reducing sugar, with regards to counteracting the potential for comorbidity, and also as a direct positive impact on managing that person's cancer scenario there and then, whilst they're undergoing treatment, in the wake of their treatment, and for non-cancerous populations, directly in the prevention of it. That takes us into the ketogenic diet, which has a lot of talk around it in modern times, and understandably why. The ketogenic diet limits carbohydrates and increases fats. The purpose of the diet is to decrease the amount of glucose, sugar, the tumor cells can use to grow and reproduce. That takes us back to exactly what we were just talking about in the context of sugar. It is a hard diet to follow because exact amounts of fats, carbohydrates, and proteins are needed. However, the diet is safe. And I know there are several clinical trials that are recruiting glioblastoma patients to a study where a ketogenic diet affects glioblastoma tumor activity. I have first-hand experience of this, and I've seen tremendous positive outcomes of it. Patients with glioblastoma who want to start a ketogenic diet should talk to their doctor and work with a registered dietitian. This is happening all over the world. Certainly here in the UK, this is becoming far more common, but I know for a fact that this is happening all over Europe, the US, Australia. So if you have a client who is undergoing this and considering this, and particularly if they have brain tumor, glioblastoma, I would encourage you to consider this. Early research has proven to be very positive, but it's not yet established how the diet affects the tumor or its symptoms. But going back to that rudimentary mechanism, this notion of reducing those sugars and therefore reducing that glucose availability that fuels the growth of these cells and tumor. This has got some part to play in the mechanism of what we're seeing going on. Do bear in mind, though, that the ketogenic diet is difficult. It's rarely strict. And in these instances where even I've used it with clients of mine, I see it very much as an intervention during treatment and acutely after treatment, with then a very graded step away from it afterwards. Maybe not abandoning all parts and aspects of it, but certainly not something that you would look to establish as a lifelong practice, but probably retaining key elements of it. And I think a part of that comes down to the fact that we simply know most people consume far too many carbohydrates. There was never an issue with carbs other than the fact that people had too many of them. That's why low carb made sense. So maybe through this strict intervention, if you can manage it with your client, then you can make a good positive impression on lowering those carbohydrates and making some changes further down the road once you're beyond treatment and beyond the acute phase of recovery. I'd certainly consider it if you have a client who has this type of cancer, this type of issue, and there's an opportunity for them to participate in one of these structured trials, then I would support them and encourage them to do so. So far, the indications are very, very positive. The low residue diet is something that you do need to probably spend a bit more time reading about beyond this episode, familiarize yourself with, because it's really common and it's really, really important. It's essential for those dealing with cancer or cancer-related surgery that affects the bowel. This can be bowel cancer, some stomach cancers, or instances whereby other comorbidities, inflammatory bowel disease, colitis, or acute diverticulitis are a factor. A low residue diet places very few demands on the digestive tract. It's similar to a low fiber diet, but also excludes some foods that can stimulate bowel contractions. So residue refers to the material left in your digestive tract after the initial stages of digestion are finished. These materials often contain a lot of fiber because the body can't fully digest fiber. So in most instances, without these complications, we promote a high fiber diet, or certainly a diet that has got a good amount of fiber in. In this instance, we are working to the inverse of that. So low residue, what to avoid? This is really important, I guess, with regards to a guideline stipulation. We want to make sure that people should consume, I mean, typically a recommendation will be that someone consumes around about 25 to 38 grams of fiber per day in their diet. However, this is not right for people with bowel cancer. A high fiber diet should be avoided for people undergoing bowel surgery or if experience IBD symptoms. When a low residue diet, a patient should consume no more than 10 to 15 grams of fiber per day, topping out, literally max their ceiling values. Patients should also avoid dairy products and certain types of carbohydrates that may provoke abdominal cramping and diarrhea. So do your due diligence on this, okay? You need to look at other options, food availability. You need to start to consider what the fiber content is of the foods that you're likely to recommend, the meals that you're likely to recommend, so that you don't surpass these ceiling limits, that you look for nutrient variety and availability, but without running the compromise of including too much of this, or too much dietary fiber on a daily basis. It's a critical consideration. So if your client has an issue that relates to this, this is your governing concern. Everything you do is going to work under this umbrella. The good news is that there is a ton of information available about this. This is one of those areas that's well explored, well considered, and there's a breadth of knowledge. So it's easy to access. I would encourage you to look at things like NIHR, the NHS web pages, look at specific pages with regards to bowel cancer to get reliable sources of information. They're your go-to kind of documents to keep yourself up to date and well informed on what your food choices might be, and really the importance of getting this right. So what to avoid? Legumes, nuts, seeds, most raw fruits and vegetables, popcorn, unprocessed coconut, most whole grains, including breads or pastas, figs, prunes, berries, dried fruits, deli meats, spicy foods and dressings, caffeine, prune juice, or juice with pulp in it, chocolate. So a lot of the stuff that we would normally advocate to be proactive about putting in someone's diet, we're going to be proactive about reducing in this diet. So this can really seem counterintuitive, but this is the way to be successful with managing your client's diet if this is where they're at. So foods to include. So again, this is going to seem counterintuitive, but we want to get those refined carbohydrates, including white bread, pasta, refined cereal in this instance, because we can get those calories in, we can get energy in. Clear juices, broths, strained soups, small amounts of certain raw vegetables, including shredded raw lettuce and skinless and seedless cucumber. Well-cooked or canned vegetables, no skins or seeds, including yellow squash, spinach, pumpkin, green beans, asparagus, beetroots, carrots, potatoes. Some raw fruit, including ripe apricots, bananas, honeydew melon, watermelon, nectarines, peaches, plums. We want to get butter in there, vegetable oil. I'm not a big fan of margarine. It kills me to say this, but this could be an area where we cast some light of consideration on its inclusion. Limited amounts of cooked fruits without seeds or skins, so we want to get them out of there. finely ground, well-cooked meat, fish, eggs, poultry, and up to 2 cups per day of smooth milk products, such as yogurt, cottage cheese. So this is kind of a hit list of key areas of inclusion. So just starting from those last 2 slides, it's going to give you somewhere to begin from, and then use these as the foundation of building up your knowledge and understanding of what's going to be appropriate and not appropriate for a low residue diet, and then work with the individual. That's the key part throughout all of this. Your client is the center of this. So you've got to figure out which amongst these lists of inclusion are going to work well for them, and which amongst those lists of exclusion you really need to target and support your client in eliminating from their diet. So low residue methods of cooking, favored approach: steaming, braising, poaching, simmering, even microwaving. It may be necessary to drink additional fluids, especially water, to avoid constipation when reducing the volume of your stools with a low residue diet. Avoid cooking methods such as roasting, boiling, or grilling, which may make food tough or dry. And in fact, that word of advice with regards to avoiding roasting and grilling can work earlier on when we've considered other types of treatment and the impact that they can have on the texture of food. And when we've got mouth sores and dry mouth and thick saliva, avoiding roasting, avoiding grilling is a key part of the strategy there as well. So as we said from the start, there is a lot of commonality. There are specifics and nuances and differences to this, no more specifically and nuanced than what will come directly from your client. But there are also key areas of common practice that work across the board. So the key point in all of this, as in all instances, when it comes to supporting someone with cancer, the principles of good nutrition are upheld. So all that good stuff that we always want to do, both from a preventative point of view, when we're working in what you might call a normalized client scenario, who's targeting wanting to get stronger, fitter, faster, jump higher, whatever it is, all of that's retained. But we've got to look at how that applies within the context of what the person is dealing with as a treatment pathway and modality. That's the key bit, and how it influences and impacts on them uniquely. That's going to start with their previous food behavior, thoughts and ideas, the nature of the treatment they're on, the nature of the cancer that's being treated, how they respond to that. What are those common symptoms that impact on malnutrition, and how are they affecting that individual? And again, being able to step back, look at the map from a bird's eye point of view, take account of where the dead ends were, and build your roads around it, never stopping to find a different way to achieve success, to get key nutrients in, to make sure that we're managing weight, to make sure that we are putting sufficient amount in the system to optimize the restoration of the system throughout, in those periods in between treatment, and 100% in the wake of their treatment. You should focus on optimizing wellness, nutrient variety and availability, optimizing the immune system, that really nice glamorous language, optimizing, normalizing the immune system with omega-3, vitamin D and vitamin C as our starting blocks. Consider the energy requirements from macros and daily calorie intake, recovery, protein, omega-3, hydration, and those carbohydrates, those good complex carbohydrates, making sure that we are stabilizing energy so that we don't have these plummets and spikes, and therefore encourage our clients to consider foods that we don't want to feature. That brings us to the end of this episode, which looked at nutrition and cancer. And I would like you to consider this purely as opening the door for such considerations. This is a huge area, which could be an entire program in itself. But I think what we've done here is we've gone through those key concerns with regards to how common treatment impacts on the individual and their nutrition status, and what it is that we can do to work through that maze, that morass of complexity, in order to support our clients towards better outcomes.